Colonoscopy has some tremendous advantages, and I've been on record in many places saying that if we're really going to increase our nation's colon cancer screening rates, we need to make colonoscopy as widely available as possible. So, from a population standpoint, one of the great advantages is that it only has to be done once every 10 years, assuming that first one is normal. So, for busy people, people who just want to address this now and then, it's a great option because it's something that only has to be done once in a decade. It has some other important advantages, though. It's the most sensitive single test we have, not just for early cancers, but for precancerous polyps. If we remove the polyp, we actually prevent the cancer. So colonoscopy does confer a great advantage as a preventive modality, as well as a method that detects cancer early. It's become very, very safe. The availability and precision with how the prep should be done is now much clearer. So we're really getting some consensus on what defines high-quality colonoscopy. And high-quality colonoscopy is one of our very best strategies to increase colon cancer screening rates across the population. As important as colonoscopy is to increase colon cancer screening rates, and it is a fabulous screening option, one of the wonderful advantages we have is that there's a second option, and that is a high-sensitivity stool blood test done every year. So there's some real important advantages of this test. One of the biggest ones is that it is very cheap. It's very affordable, particularly those who face a copay or have some other costs associated with colonoscopy. And certainly for the uninsured, the stool blood test is a great option. Here's another real key advantage of that test. In modeling studies done by the MISCAN model, we've been able to demonstrate that the reduction in colon cancer mortality that would result from stool blood testing versus colonoscopy, if you follow the guidelines precisely, in fact would be the same. Now, that's a great advantage, just remembering, though, that means you have to do that stool blood test every year, and everybody who tests positive must have a colonoscopy. So with 100% adherence, we actually can achieve the same reduction in mortality. One of the things we've proven is really liked by many patients is that this test can be done in the privacy of your own home. In fact, that's how it has to be done. This is not a stool blood test following a rectal exam. This is a kit that you take home, and you test spontaneously past bowel movement. That's what the data shows. That's how these tests are done. Good news is that in the testing of messages that we've performed at the American Cancer Society, we know that cheap, affordable, take-home options motivate change for people who otherwise, frankly, would not be screened for colon cancer.
Speaking about FITs and the challenge of doing them every year, I think sometimes people drift towards to FITs and FOBTs because they seem like an easier test for the patient to do, but they can actually be a little bit of a burden on the clinic to make sure the person does them every year. So I always caution people when they start FOBT and FIT programs, you really have to build the infrastructure to support your ability to reach out to those people every single year and make sure they come in and get their FOBT or FIT test, because that's a test that works on the basis that you get it done every year, not just once. Depending on what test you have, things like insurance may impact your ability to get screened. So fecal occult blood tests are actually relatively inexpensive and fairly easy to get. But if you have a positive test, then you need a follow-up colonoscopy. That costs money. So obviously, if you don't have insurance, that is certainly a barrier to completing the screening cycle. And if you want to have colonoscopy as your primary test, obviously not having insurance would be a barrier to getting that test done. There are other test options, but they tend to fall in terms of cost on the range in between somewhere, the fecal occult blood test and the colonoscopy. So cost is definitely an impediment. Even if you do have insurance, under the ACA, all preventive tests are supposed to be covered, but there are a few loopholes in there, one of which is if you have a screening colonoscopy, especially if you have Medicare, and they find a polyp, and you have that polyp removed, then it becomes a diagnostic colonoscopy, and then those procedures are subject to copays, which are not minimal, let's put it that way. And then the same issue if you have a fecal occult blood test and it's positive, and then you have to have a follow-up colonoscopy. That follow-up colonoscopy is also considered diagnostic. Same copays apply. So there's some kinks and issues that need to be worked out to make colorectal cancer screening more accessible across all groups.